Module 1 Foundations of Health Economics and Healthcare Systems. 1. Introduction to Health Economics. Let's start with a simple question. What is health economics? Health economics is a field of study that examines how scarce resources are allocated within the health sector, and how these resources can be used most efficiently to improve health outcomes. In simpler terms, it's about understanding how money, time, and effort are spent in healthcare, and figuring out the smartest ways to use them. It's important to remember that resources, whether they are hospital beds, skilled doctors, vaccines, or research funding, are always limited. No health system, no matter how rich, can provide every possible service to every person, at the highest quality, at all times. That's where economics comes in, to help us make choices. Why is health economics important? Because health is priceless in one sense, but in another sense, we have to put a price on what we can and cannot provide. Governments need to decide, should we spend more money on heart surgeries or on preventive vaccines? Should we fund an expensive cancer drug that only helps a few, or a cheaper treatment that can help thousands? These are not just technical questions, they're ethical, political, and social as well. The field blends economic theory, public health, statistics, and policymaking. And, perhaps most importantly, it gives us a framework for making rational, transparent decisions in situations where emotions and politics could otherwise dominate. 2. The concept of health and why it matters in economics. Before we dive further, let's pause to define health. The World Health Organization, WHO, defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is more than just feeling not sick, it's about overall quality of life. In economics, health is both a consumption good. We value being healthy for its own sake, it makes us happier and allows us to enjoy life. An investment good. Good health allows us to work, earn, learn, and contribute to society. This is where health economics overlaps with human capital theory, the idea that investing in people's education, skills, and health boosts economic productivity. So, health matters in economics because it influences individual productivity. The healthy workers are more productive, take fewer sick days, and retire later. Economic growth. The healthier population can contribute more to the economy. Government spending. Poor health increases the burden on health care services and social security systems. One key insight in health economics is that health care and health are not the same thing. Health care is just one factor that influences health. Other factors, such as education, income, housing, nutrition, and even social connections, often have a bigger impact. Economists call these social determinants of health. 3. Understanding health care systems, models and structures. Now that we understand why health matters, let's talk about health care systems. A health care system is the combination of people, institutions, and resources that deliver health care services to meet the health needs of a population. The way a health care system is organized has a huge effect on access, quality, and cost. Economists often categorize health systems into three main models. 1. Beverage model. Funded through taxation, like other public services. Health care is provided and financed by the government. Examples: United Kingdom's NHS, Spain, New Zealand. Pros: universal coverage, low cost per capita, emphasis on prevention. Cons: risk of long waiting times, budget constraints. 2. Bismarck model. Based on insurance systems financed jointly by employers and employees through payroll deductions. Providers can be private, but are regulated to ensure universal coverage. Examples: Germany, France, Japan. Pros: high-quality care, choice of providers. Cons: can be costly to maintain, requires strong regulation. 3. National health insurance model. A single government-run insurance program that citizens pay into, but care is delivered by private providers. Example: Canada, Taiwan, South Korea. Pros: lower administrative costs than multi-payer systems, universal coverage. Cons: possible wait times for certain procedures. 4. Out-of-pocket model. Individuals pay directly for services when needed. Common in low-income countries with limited health infrastructure. Pros: no big government system required. Cons, access depends on ability to pay, leading to major inequalities. Most countries actually use a mixed model, blending elements from all four. 4. Demand and supply in healthcare markets. Economics is about demand and supply, and health economics is no exception. Demand in healthcare. Demand for healthcare is unusual because we often don't know when we'll need it. The consumer, patient, often isn't the one deciding what to buy, the doctor does. Healthcare is often paid for by insurance or the government, so the price we pay directly is much less than the actual cost. This leads to moral hazard, when people consume more care because they are not paying the full cost. For example, if an insurance company covers unlimited doctor visits, some people might go for minor issues they'd otherwise ignore. Supply in healthcare. The supply side is also unique. Healthcare providers, doctors, hospitals, require years of training and heavy investment. Technology and pharmaceuticals are major cost drivers. Regulation is strict to ensure safety and quality. In a perfect market, supply and demand set prices and quantities. But in healthcare, the market is often distorted, prices may be regulated, providers may be limited, and there's an ethical obligation to provide care regardless of someone's ability to pay. 5. Market failures and the role of government in healthcare. Healthcare markets don't behave like markets for shoes or smartphones. There are several common market failures. Externalities. Positive externalities occur when a health intervention benefits others besides the patient. For example, vaccinations protect the community through herd immunity. Negative externalities happen too, for example, antibiotic overuse leading to drug-resistant bacteria. Public goods, some health services, like disease surveillance, benefit everyone and can't exclude anyone. Because no one can be denied these services, the market alone won't provide enough of them. Information asymmetry. The patients typically know less than doctors about what they need, which can lead to over or under treatment. Because of these failures, governments step in through regulation, subsidies, public provision of care, insurance schemes. 6. Health as an investment and a consumption good. This is a classic concept from Michael Grossman's health capital model. As a consumption good, health directly increases our quality of life. As an investment good, health enables us to be productive, earn income, and reduce future medical costs. Economists often emphasize the idea of lifetime health capital, the stock of health we are born with, which changes over time due to lifestyle, environment, and medical care. The key point: good health yields both personal and economic returns. 7. Measuring health and health inequalities. You can't improve what you can't measure. In health economics, measurement is vital. Common health measures. Life expectancy, the average number of years a person can expect to live. Infant mortality rate, deaths of infants under 1 year per 1,000 live births. Morbidity rates, measures of illness. Quality-adjusted life years, QALYs, combines quantity and quality of life into one measure. Disability-adjusted life years, DALYs, measures years lost due to ill health, disability, or early death. Health economists also look at health inequalities, systematic differences in health between different population groups. This may be linked to income, education, geography, gender, ethnicity, or other social factors. 8. Introduction to costing in health economics. Before we wrap Module 1, let's talk about costing. In health economics, cost doesn't just mean money spent. It can also include direct cost, cost of hospital stays, medications, doctor visits. Indirect costs, lost productivity due to illness. Intangible cost, pain, suffering, loss of quality of life. Accurate costing is essential for comparing different health programs, deciding how to allocate limited resources, understanding the economic burden of diseases,